Polycystic ovarian syndrome is a very common endocrine problem seen in women of reproductive age group, and it can affect nearly 10% of women of childbearing age. If it is so common, why are we also worried about PCOS? It's because PCOS has so many varied symptoms which are possible to be seen in even women who are normal or without a PCOS. PCOS can present with symptoms like irregularity in the cycles, weight gain, acne, unwanted hair growth, irritability, mood swings, and so many different kind of problems can happen. But how do we diagnose if the woman really has a PCOS? There are three criteria, which is when, if they are present in a woman, she is considered to be having a polycystic ovarian syndrome. All three criteria need not be present in a PCOS. Even if two of the three, which we are going to mention now, is present, then a woman is considered to be having a polycystic ovarian syndrome. If a woman has irregular cycles, that is not being able to produce an egg on the right time or release an egg, which is called anovulation, is one of the features. The other is having excessive male hormones, which are called androgens. If you do a blood test and if male hormones are higher in level, then also it is considered to be a positive sign for a PCOS. If you do an ultrasound scan in a woman with a PCOS, and if you find ovaries which could be enlarged than a normal size, and there could be multiple small bubble-like structures which are called cysts in the ovary, if they are more in number, then again this is also a criteria to be diagnosed as a polycystic ovarian syndrome. See, if two out of these three are present, then a woman is considered to be having a PCOS. So every woman who has androgenic problems like excessive hair growth, or any woman or every woman with obesity need not be considered as having PCOS. In the same way, if you do a scan and find out that there are lots of bubbles in the ovary, it does not mean that she definitely has a PCOS. So there definitely need to be 2 out of 3 criteria to be fulfilled for a woman to be called a PCOS. So one should not brand a woman unnecessarily as having a PCOS. So does a PCOS mean that they are not going to have pregnancy on their own? There are many a times where, in spite of having irregular cycles, there is a possibility of pregnancy on their own without any kind of a treatment. And it does not mean that a woman who is obese also is having a PCOS.